They asked a lot about letdown, but again, my breast felt full, but I couldn't tell when my milk would start flowing. So there's all of those challenges. So having somebody that's knowledgeable, that's experienced, that knows more about lactation after spinal cord injury so that they can give you more evidence-based advice rather than just guesses or assumptions would be really helpful.
Women with cervical injuries tended to not experience the letdown reflex, and in addition to not producing enough milk, they weren't sure if their babies were satisfied after a feed because milk was not coming out and they didn't really feel the entire cycle of that reflex happening.
For breastfeeding for spinal cord injury, the intercostal nerves from T4 to T6 it can be impaired. So again, that interferes with that reflex and the letdown reflex. So that may interfere with how well how much milk the baby can get. And it also interferes with the feeling, right, of having that letdown reflex and that something is about to happen.
In terms of blood pressure, after I had Riley, I had very low blood pressure. Before I had her, I had very high blood pressure, like we're talking 200 over 100. That's why I had to get admitted. After, I was dealing with like 70 over 30. So I was lightheaded, I was dizzy. So for what I had to deal with my low blood pressure was just reclining. So I had to be able to recline so that the blood could get back to my head. If not, like I could not see anything.
Simple task of sitting, which again many people without spinal cord injury don't even think. It's not difficult. I can sit anywhere for how many times, for how long, doesn't matter. Individual with spinal cord injury, depending on the level of injury, sitting for a long time in the same position is a challenge. Why? Because arterial blood pressure is changing dramatically in people with spinal cord injury when they're assuming position from supine to seated. Typically what we will see, blood pressure will drop, what we call orthostatic change in blood pressure. This condition typically associated with very unpleasant sensation, lightheadedness, dizziness, sweating, fatigue, and that's why for a woman who is planning to become a mother or who is trying to breastfeed, she has to sit for quite a while to keep quiet and nurse her child. This could be a challenge.
I don't have sensation at my nipple level, so it was hard for me to tell if he had a good latch or not. So my nipples became damaged and bruised and were bleeding. Then I started having autonomic dysreflexia when I was breastfeeding. I tried to ignore that and I didn't really tell anyone that was happening because again, I was told there was no reason why I couldn't breastfeed, so I kind of attributed it to other things.
We do know from the able-bodied females that sometimes child could grab nipple quite strong. Women without spinal cord injury will have pain and unpleasant sensation for a period of time, but then it will relax. In women with spinal cord injury, this strong nipple grab by child could result in cessation that will trigger episode of autonomic dysreflexia, which is life-threatening condition. So this is another very unusual barrier and challenge in women with spinal cord injury when they're planning to become mothers.
Really happy that I had that support system, but mentally it's really hard when you're kind of feeling a bit stuck in bed and not back to your normal routine as you would have hoped. So I wasn't really super prepared I think they prepared me really well for the delivery and the pregnancy itself, not for the after stuff that could possibly happen. So.
Compared to the 13% of women in the general population who typically do experience postpartum depression, women with SCI were nearly 2 to 3 times as likely to experience self-reported postpartum depression compared to the able-bodied population. And that's huge. We don't know whether or not it's a result of their injury or maybe the extra barriers that they experience to breastfeeding and motherhood in general. It could be negative public perception of women with a physical disability who do choose to pursue motherhood. But either way, what the study has shown us is that there needs to be a lot more support, both clinically and socially, for women who are undergoing breastfeeding with spinal cord injury.
Women sitting out there wondering whether or not they can have a sexual life, whether they can have a baby, whether they can be a regular parent like everybody else. The message is yes, you can. So there might be some adaptations, there might be some barriers along the way, but most of them can be overcome.
The breastfeeding is a relationship, and that even if you're not able to breastfeed or make enough milk, that we would encourage you to still, spend time with your baby skin to skin and take that time to fall in love with your baby. And that any amount of milk that you can give your baby is a gift. And it is about that relationship and learning about each other.
What to do when women with spinal cord injury develop episodes of autonomic dysreflexia during breastfeeding? Don't be upset. Know what to do. Go to find a specialist, physiatrist probably, and talk about what can be done in order to prevent developing of autonomic dysreflexia while you're breastfeeding.
So whether you have a spinal cord injury or not, some women have trouble with milk production. So there are medications that can sometimes help make that better. And sometimes there's some herbs, but really I think the most important thing is to see either your doctor or your lactation consultant to figure out how you might be able to promote more milk production.